Managed Meds mobile app by Corey Griffin, LPN. Presenter. My name is Corey Griffin, and I am currently a licensed practical nurse at Dartmouth-Hitchcock Medical Center in Keene, New Hampshire. I'm here to present to you the solution to a major healthcare issue that affects both healthcare consumers and providers. This project description presentation details the solution to a medication noncompliance and medication-associated hospital stays by integrating the Managed Meds app into Dartmouth-Hitchcock Medical Center. Agenda. This presentation will include a description of the problem at hand, a solution to said problem with 3 ramifications, supported data, and a budget and conclusion. The problem at hand, ramification number 1. Not understanding education provided. Paper handouts are currently provided at my work upon request about medications. These papers can be very wordy, easily lost, and generally only given upon request. Patients are sometimes too embarrassed to admit they don't understand the information being provided or just want to leave the hospital in a hurry, so they leave without understanding their new medications they are being prescribed. According to the American Journal of Health System Pharmacy, in terms of discharge reconciliation, the scope of this problem extends into the patient's home. Many patients experience confusion during transition from acute care settings to home in regards to medication change. Ramification number 2, drug non-adherence. If patients do not understand the information provided to them, they may not follow the important guidelines needed to assure safe medication administration while at home. A common issue that occurs with non-adherence is patients not taking their necessary medications because they think they feel fine, such as psych meds or heart medications. Studies have shown medication non-adherence has been associated with worse patient outcomes, poor quality of life, reduced physical function, and advanced cognitive impairment. The morbidity and mortality associated with non-adherence in the U.S. has been shown to increase healthcare costs by approximately $1 billion a year. Ramification number 3, adverse drug events. According to the Office of Disease Prevention and Health Promotion, an adverse drug event is an injury resulting from medical involvement of a drug. An involvement may include, but is not limited to, medication errors, allergic reactions, and overdoses. Those who experience said drug events are likely to need medical assistance for positive outcomes. A study observed by the American Journal of Health System Pharmacy said, it is estimated that approximately 20% of patients who are admitted to the hospital require acute care services within 30 days of discharge. What is it? There is a deficit in the patient education and knowledge about medications that needs intervention. The community in which I am trying to create this application for has a large population of elderly patients and patients who take multiple medications. This app I am creating will make accessing accurate medication information easier. The patients and their caregivers could access this application on mobile devices anywhere they need to. How does it work? The app will include drug identifications, interactions, methods, routes for taking, and possible side effects. The user will have their current medications downloaded by their healthcare provider. A search option will also allow for patients to look up other over-the-counter medications and supplements. How does it solve the problem? This will decrease the incidence of medication-associated hospital stays and help patients in feeling educated about their medications by assuring accurate and up-to-date medication information is always readily available. Budget. The cost for an application designer would be approximately $60,000 a year. Given that the launch and initial design would only take about 2 months, the designer would only need to be employed for 4 months to ensure the app is running smoothly. This would mean the total salary would be only $15,000. In conclusion, if patients and their caregivers were able to easily access current, simplified information about their medications, these adverse issues may subside. This would lead to better patient safety outcomes, less hospital stays, fewer medication interventions, and lower medical costs. In turn, patients would feel more confident in the education and resources they have to access to empower them in their care.